I'm Dr. Kiiru, JM, consultant obstetrician and gynecologist working with Westlands Medical Center. Today we are going to talk about antenatal. Antenatal is the care you receive while you are pregnant to make sure you and your baby are as well as possible. We will check the health of you and your baby, give you useful information to help you have a healthy pregnancy, including advice about healthy eating and exercise. We shall also discuss your options and choices for your care during pregnancy, labor, and birth, and answer any questions you may have during your antenatal care. All moms-to-be are offered the following. Number 1, 2 pregnancy ultrasound scans at 8 to 14 weeks and at 18 to 21 weeks. 2, antenatal screening tests to find out the chance of your baby having certain conditions such as Down syndrome. And 3, antenatal profile, which involves checking your HB, your blood group, to find out whether you have syphilis, HIV, hepatitis B. We shall also do urinalysis as part of your antenatal profile. You will also be offered antenatal classes, including breastfeeding workshops. You may need to book this in advance. You can book an appointment with us as soon as you find out you are pregnant. It's best to see us as early as possible to get information you need about having a healthy pregnancy. If you have special health needs, we may take shared responsibility for your maternity care. This means we will all be involved in your care during pregnancy. Let us know if you have a disability that means you have special requirements for your antenatal appointments or for labor. If you are expecting your first child, you will have up to 10 antenatal appointments. If you have had a baby before, you will have allowed 7 appointments. But sometimes you may have more. For example, if you develop a medical condition. Early in your pregnancy, we will give you written information about how many appointments you are likely to have and when they are likely to happen. If you can't keep an appointment, let the clinic know and make another one. Antenatal appointments should take place in a setting where you feel able to discuss sensitive issues such as domestic violence, sexual abuse, mental illness, or drugs. To make sure you get the best pregnancy care, we will ask you many questions about you and your family's health and your preferences. We will carry out some checks and tests, some of which will be done periodically throughout your pregnancy, such as urine tests and blood pressure checks. The results may affect your choices later in pregnancy, so it is important not to miss them. Questions we might ask you include the date of the first day of your last period, your health, any previous illnesses and operations you have had, any previous pregnancies and miscarriages, the ethnic origins of you and your partner to find out whether your baby may be at risk of certain inherited conditions, or other relevant factors such as whether your family has a history of twins, your job, your partner's job, and what kind of accommodation you live in to see whether your circumstances might affect your pregnancy, how you are feeling, and whether you have been depressed. Your antenatal appointments are an opportunity to tell us if you are in a vulnerable situation or if you need extra support. This could be due to domestic abuse or violence, sexual abuse, or female genital mutilation. From around 24 weeks of pregnancy, your antenatal appointments will usually become more frequent. However, if your pregnancy is uncomplicated and you are in good health, you may not be seen as often as someone who needs to be more closely monitored. Later visits are usually quite short. We will shake your urine and blood pressure, feel your abdomen to check the baby's position, measure your uterus to check your baby's growth, and listen to your baby's heartbeat. You can also ask questions or talk about anything that is worrying you. Talking about your feelings is as important as all the antenatal tests and examinations. You should be given information about making your birth plan, preparing for labor and birth, and how to tell if you are in active labor. Induction of labor, if your baby is overdue, that is after your expected date of delivery. The baby blues and postnatal depression, feeding your baby, vitamin K, given to prevent vitamin K deficiency, bleeding in your baby, screening tests for newborn babies, and looking after yourself and your baby. At each antenatal appointment from 24 weeks of pregnancy, we will check your baby's growth. We also advise you to keep track of your baby's movements. At any stage of pregnancy, if your baby's movements become less frequent, slow down or stop, contact us immediately. Don't wait until the next day. You'll be offered an ultrasound scan if there are any concerns about how your baby is growing and developing. Appointments. Thank you. Kindly do not forget to subscribe to our YouTube channel. You can also follow us on Facebook and Twitter, or visit our website and our blog to book appointments. Thank you.